So this week we had something happen with us that was disturbing to say the least. My girlfriend has been having to look for a job, and to deal with her anxiety and at times pain, she does cannabis or marijuana. And due to the stupid laws, the drug screening laws that all jobs have for some reason, which has never made sense to me. I don't understand why people who are not involved with safety and not involved with things like that have to take drug screening before they take the job. This needs to end as far as I'm concerned. So anyways, she did her due diligence and went to a doctor to get something that would help her with this situation and not have to be on pot. That way when she goes for a job, she won't fail the drug screening. So go ahead and explain what happened.
So yeah, and maybe I should clarify a little more as well, just to kind of get my thing flowing. Okay, so yes, I've been using cannabis for my depression for a long time. Back before I used cannabis, I was prescribed antidepressants as well, so I have had a history with antidepressants. So there's that issue that will come up later in the video, and I'm talking about it. But yes, I've been using cannabis for some time. It really helps. I don't use it all the time. I never have used it all the time. I'm a functional person. I have done a lot. I am not someone who just sits around. I graduated magna cum laude with honors. So it's not like I'm not functional. I can function and still take marijuana. And that's a myth. I mean, it might happen for some people, but it's a myth. So anyways, my thing is I really want to do the entrepreneurial thing, and I've gotten some things that I have done for being an entrepreneur, and but the thing is, I'm still starting out, and getting my name out there isn't always as easy. It takes time, and you know, I'm in debt because I have college loans to pay off. So I can't just sit around and wait for the money to come in over years. I have to do something. So I was looking at the jobs that are out there, like you know, yeah, I'm going to look at jobs that I want to do, but it's like, so even some of the jobs in my field will drug test. Even jobs that suck, like working at grocery stores, drug test. And the thing with drug testing is that you can, like, let's say you're an alcoholic and you drink all the time, and you just don't drink for the day of your little test, or I don't even know if they test for alcohol, probably not. And you're clean because it doesn't stay in your system that long. But you smoke once or twice, or you know, a few times a month, and it's in there, in your system for a month. And so what I decided to do is go cold turkey, because I have to get out of my system in a month, you know, and I've been using niacin to help drain that out, because that'll help as well. And so I've been doing that to get my system cleared, but that just made things worse because my depression came back and there was no way to treat it. I can't smoke, so I'm like, shit, I have to do something. So I went to go see a doctor. And part of that was to talk to someone, but also it was to get some kind of legal medication that I could take until I find a job, and then, you know, get rid of the medication because it didn't work anyway. But I needed something, right? Because it was just, and it isn't really like the inner stuff, it's more like the outer stuff that's you know, like things that we can't help, like finances, like how am I supposed, you know, there's things like that come into, you know, and also too, like how do you get your name out there when nobody knows you exist, or and how much longer it takes these days to get on the internet and to be known, and also you can't say certain things or you ruin your online career. And just bullshit like that. So it's very depressing. It is very depressing, and it makes you have horrible thoughts. And it's just like, I can't do this. I need some help, and I can't take the one thing that can help will keep me from getting some jobs. That's bullshit. But anyways, so get to the point. I went to talk to someone, and they prescribed me Okay, it's called Seroquel. I'm not going to be able to say this name right, but the scientific name is Quiapine fumarate. Quietapine. It's also called Seroquel. But yeah, I didn't do my homework on this because I just got it prescribed to me. I later looked at what it was after I started having crazy symptoms. This is a mood stabilizer. It's supposed to equal out your more joyful, happy times and your low, sad times. It's supposed to make it a balanced, which is something that I wanted. But it comes at a cost. It does that, but it makes you sleep all the time. So you don't really have time to be happy or sad because you're sleeping. When you're awake, you're a zombie. And when you try to do something, you start having these horrible heart palpitations. Like I was on the keyboard writing something and my heart was like beating like this. And it reminds me of something I took in the Army, which they probably had me on this in the military. And I just didn't know it because it was a mood stabilizer. And I like just walking, my heart would pound. But the other day, I was typing, like last night, I was typing, my heart started pounding just for typing a sentence. I had to stop. The room started turning black with like little white specks, and they had like static in my ear, and I thought maybe it was water, but then it came back again. Static in my ear. This is used to also treat, more importantly, it's mainly used to treat schizophrenia. I don't have schizophrenia that I know of. Like I'm not an active schizophrenic. So why are they giving this to me? Yes, I know it's a mood stabilizer, but it's still this is what this, like the only people I could see benefiting from this at all, it would be like really, really violent schizophrenic people who have violent episodes of schizophrenia and are not able to function, that are in a psych ward, because you cannot function in the daily world on this. You have to be asleep. How the fuck am I supposed to get a job if all I'm gonna do is sleep and I can't even fucking type a sentence without having like a fucking heart attack?
Right. I mean, this is the issue is this.
Hella mad.
The first day that she was on it, I noticed immediate difference. My usually active, creative, dancing around girlfriend was knocked out. I'm serious. I mean, this is the worst I have ever seen her. Even when she's is depressed, and everybody gets depressed. That's the other thing. We'll cover that later. I was just like, oh my God, what is wrong? Years and years ago, I had my ex. She got, she was happy-go-lucky, fun individual, and she was also taking some hormones for a health condition, and she took those hormones and her mood changed like from night to day, and I've never encountered that before as far as the mood swings. Then before, I had a lady friend of mine who had a doctor. She hurt herself in our jiu-jitsu class, and she was she went to a doctor, and the doctor put her on some painkillers, but also said, "You're too thin for your age. Here, have these pills." It's probably not stated like that, but basically what it was she was put on birth control. And very slowly over time, she gained more weight. She was more susceptible to colds. She was, and her over time, her ovaries got screwed up. And I place my blame fully on the doctor that put her on birth control pills at 14 bloody years old. My point about these three instances is we have pill-happy doctors, as we all know.
They get paid.
And they get paid by the pharmaceutical industries to push these pills. And that's what they are. They're pill pushers.
Legalized drug dealers.
Now, here's the thing. She is usually really active, as I said.
Oh, yeah.
On the computer, just typing away, doing her thing, making art. And then when she's not doing that one, while the computer is doing something, she's in front of a mirror belly dancing. And this is not what's not happening.
Oh, I couldn't dance
2 days.
On that. Mm-mm.
The second day, when I came home, house is dark, computer's off, nothing's going on, but the cats are out and her handbag's home. I'm like, oh, she is asleep. And I just left her alone. I knew I had a feeling what had happened, and that was some damn reaction with these drugs. I'm trying to understand why it is that cannabis or pot or marijuana or Maui Wowie, whatever the hell you want to call it, it makes people feel good, it makes people healthy, it makes people active. I'm tired of people saying that people on pot are lazy. No, they're not. She was on it, and she was active, and she created her own tarot deck, or not tarot deck,
Oracle deck,
Oracle deck,
on another one,
and working on another one, has been belly dancing for years, and all of this, and I keep hearing people say, oh, people on pot are lazy and good for nothing, blah, blah, blah. No, people on this crap are lazy and good for nothing.
They can't do anything.
Because they can't do anything. Okay, now the thing is, I'm looking at this sheet, and this, I wish I could cue elevator music in the background while I read this, because it would just be hilarious. Are you ready for this? Warning! There may be slightly increased risk of serious, possibly fatal side effects, such as stroke, heart failure, irregular heartbeat, and pneumonia. Okay, side effects of pot. You might want to eat Twinkies. Side effects of this shit. You might die. What the fuck? How is this supposed to be good? Now, I could probably see there might be cases where this stuff is necessary for a patient, as she said.
You'd have to be like
true schizophrenia.
Like that's the better option, even risking death, because they're so violent and so
exactly. But she's not a schizophrenic. She is someone who uses marijuana to deal with some light anxiety, so she can perform well in her job. And yet, instead of being able to use that, she has to use this stuff, which makes her, I'm sorry, hon, it makes her useless for a job.
It would. I don't see how that's going to help me. The whole idea was so that I could get a job and pass a drug test. I can't even fucking type a sentence on a computer without my heart going a mile like this, and the room going dark, and there's like white stars, and my hearing is going. Like, what the fuck is going on? It looks like it gives you schizophrenia.
That's some serious shit. And the reasoning, just the reasoning for this anti-drug, anti-pot stuff is...
That pissed me off, because I am very productive with that. It helps me in so many ways. And not only that, and I don't only use it for depression. I have IBS, which I probably got from this stuff, because this stuff looks like the side effects give it to you. And then I treat it for menstrual cramps and stuff. And headaches. I have all 4 of those things, probably more, that I use it for, and it helps all of them. All of them. It helps all of them. And this actually gives you... It actually gives you IBS symptoms. It gives you some of the symptoms. So now I need other drugs, and then I gotta worry if the other drugs will have an effect with this drug. When I could just take one thing, and that one thing is legal, but this shit is legal? This shit should not be legal. At least not for mainstream, like, actual, like, functioning patients.
Right. That's what I'm thinking. It's like, this should be, like, last resort stuff.
That's like,
This should not be the first thing that she is diagnosed,
it was the first thing they gave
prescribed. For this
100 milligrams twice a day. I only took 2 pills. I took one at night because she said it's best to start at night, for obvious reasons, and then 2 the next one the day after in the day. And even like after a few hours, I still have that weird the whole, and you get like this weird mouth and throat thing. So like there's a joke about like cotton mouth with pot, which does happen, and you drink water and stuff. This is severe cotton mouth and cotton throat. Like, it goes all the way down, and it's like it's still with me today.
Yeah.
And I haven't taken any pills. I'm not taking any more pills. I'm going to return that and say I don't want to pay anything, because I only took 2 pills, and this is dangerous, and you gave it to me. And, like, it's so fucked up. And also, you lose time, because I think, I honestly think that this is the thing that they gave me in the Army, where I lost an hour of time. And I fucking lost some time this weekend.
Right, that's what I was about to say, is this morning I was doing something I don't normally do on a weekday morning. And she was like, why are you doing that now? Don't you have to go to work? I'm like, it's Friday, hon. And it's not Friday, hon.
I didn't hear you say it was Saturday. I was still trying to figure out why.
And she didn't know that it was Saturday. She thought, she was asking, where did my Friday go?
I don't know where Friday went, because where did Friday go?
I've had times where I've woken up and I'm thinking, it's a different day than what it is. But no, this was serious. This was like true time loss here. All right, so here are the side effects. Are you all set for this? Side effects. God, I wish I could cue that music. See also warning section. Well, we read the first part of that warning section. I'm not going to go too further on it. But this one I'm going to try to read. All right, so here they are. Constipation, drowsiness, upset stomach, tiredness, weight gain, blurred vision, dry mouth may occur. If any of these effects persist or worsen, tell your doctor promptly. Dizziness or lightheadedness may occur, especially when you first start or increase your dose of this drug. Dizziness and lightheadedness can increase the risk of falling. You don't say!
Oh, you remember when I got up and I'm all, whoa!
I thought, you know what? I thought dizziness meant that when you stand up really quick, you're just going to stand up really quick and be able to walk. No.
Whoa!
Dizziness might cause you to fall. Well, imagine that. Get up slowly when rising from a sitting or lying position. Remember that your doctor has prescribed this medication because he or she has judged that the benefit to you is greater than the risk of the side effects. The side effects being drowsiness, upset stomach, tiredness, weight gain, blurred vision. Blurred vision? This is a positive? Ha! I don't think so. Many people using this medication do not have serious side effects. Tell your doctor right away. Here's the thing. If you go onto YouTube and you type in the name of this drug, there are a lot of people saying, don't use it. This is a bad drug.
Oh, look, there's more.
Oh, wow.
Oh, shit. Oh, there's more.
There's a section here called serious side effects. Like these ones weren't. Let's see. Include restlessness, constant need to move. That's a big load of shit.
Oh, wait, no, because remember when I was resting and stuff, but remember when I was on the keyboard?
Yeah.
When I was typing, and then when that thing was happening, I was kind of shaking and moving.
Okay, so
I had the shaking.
There is something here about shakiness and tremor. Signs of infection, such as fever, persistent, sore throat.
I got sore throat.
She was getting hot, so that would work.
Still have it.
Mental mood changes. Wait a minute. I thought this was supposed to stop that. Mental moods changes, such as increased anxiety, depression, thoughts of suicide.
Why even take the fucking pill?
Wasn't it supposed to stop this?
Oh my god.
I'm not going to read any further. Basically, maybe I am. Holy crap. When I see the word kidney and failure, that's not good. Yeah, so let's see. Difficulty swallowing. Constipation with persistent abdominal pain.
Haven't had that yet.
That would be, what was that? IBS? Is that what you said?
IBS. Okay,
IBS,
so when I had IBS in the military, they treated me. What would happen? I'm sorry, this is for a little mark your place. I had it to where, and I think this is where I was probably taking this drug. Now that I think back, it's very similar. At one point in my time in the military, my insides were squeezing. It felt like they were squeezing. I had one day I'd have constipation, the next day the other stuff, and then sometimes my food wouldn't even digest. So I had the whole symptoms of IBS, but it'd always be something different. Now I never put it together that it could have been side effects from this drug, because I was taking a mood stabilizer at this point in time as well, so it could have been linked to the medication I was taking, and I had no idea. So that's very interesting that could have caused that. That was probably one of the reasons why. And I treat that now, which I don't get that much of anymore, but when I do, marijuana takes care of it. It's actually a treatment for IBS.
So, I'm actually not going to read this whole thing. Basically, they do say if you encounter any of these, contact your physician. Okay, fair enough. The fact this drug can actually cause these things, and they used this as the first measure to help my girlfriend, it's like using a hammer to kill a fly. You're going to blast holes in the wall to kill a fly.
Well, it's really interesting that they didn't talk about, okay, now this is just like an ethics thing for me. Now, they send you home, once you have the pills already, they send you home with this stuff.
Yeah. They don't let you read this before they give it to you.
They should let you know.
Read it after.
And I don't think that she was okay. So the person that talked to me was supposedly a counselor. I didn't think she was a psychiatrist, because she says that she was going to set me up with an appointment with a psychologist and a psychiatrist, because the psychiatrist is the one that gives you drugs, the psychologist is the one that talks. But why is she giving out drugs then? She only spent like half an hour with me, and hasn't even really diagnosed me, because that's what the psychologist and the psychiatrist do. So if she's not a psychiatrist, why is she passing out drugs? That would be a question as well.
Well, by the way, hon, it's in notes here. It says, "Do not share this medication with others." So you can't, you and I can't share this for getting blasted out.
Well, you know what? I could see it as a really risky street drug. I mean, if you wanted to, I mean, because you'll have to be lying down, but you will have some really crazy shit happen. And also, I didn't know it was a schizophrenia drug until I got the paper. I'm like, oh, it's for schizophrenia. I had no idea. But it feels like it gives you schizophrenia because it makes your third eye, and I'm all okay with looking at the third eye and doing that. But that first night I took it, off the hook third eye shit. I closed my eyes and I could already see pictures and it was very liquidy though. It was very liquid, and it was very close your eye and
that would be your brain melting.
It was weird. And again, I'm a spiritual person. I'm all about the third eye, but this was really, and part of some aspects of schizophrenia is probably an overactive third eye where you're just totally seeing things all the time, which is not healthy. But if this is supposed to treat it, then why is it inducing that sort of effect?
Right.
So that makes you think.
So, in conclusion with this video, please be aware of what you're being prescribed, and if you can, try to get that sheet from the doctor before they give it to you.
Yeah.
My girlfriend did not go in to be treated for schizophrenia. She went in to be treated for light anxiety that she can take care of with pot. And her case is just another one of those millions of cases that are trying to say, legalize pot. Just legalize it. Stop this ridiculousness.
And let it so that you can get a job on it too.
That's the other thing. Take pot off of the screening.
It shouldn't be
on
on
for
there.
the other drugs. Yeah. Don't screen for pot. It's ridiculous.
It's stupid. And functioning people smoke pot.
And as she pointed out about alcohol, it's like at my job. I have to do a drug test. Random drug test program is what our place has. And they test you for marijuana, they test you for alcohol. Now, the alcohol is testing to see if you are drunk or if you are inebriated while on the job. Because alcohol, as you know, once it wears out, it's out of your system and it's subject. Whereas pot stays, the chemicals sort of stay in your system, but they're not affecting you. And so it's when they do the test, you could be weeks away from when you had your last joint, and you can still fail the test. Although your mind is working perfectly, you're working just fine, and yet you can still fail a test. And that is ludicrous, especially when she probably could have passed a job interview with this shit in her system.
Yeah, I couldn't, because I would be
But she wouldn't be able to do it because she'd be like...
You can't even do simple mundane tasks without and they're probably like, oh, well, that's when it's beginning. Well, according to people online, it's not
That's
just
not
the
when
case.
it's beginning. That's something else we saw. It says people who are first using this product may experience these things. No, they experience it all the time. It's just this overprescribed, things being overprescribed, and also people not wanting to deal with what I think. Personally, I think a lot of depression cases are due to our lifestyles, are due to the pressures we have in life.
Outside forces.
Outside forces. Now, I know there's internal depression. I understand that. But what I'm saying
Mine are mostly
is...
outside forces.
Yeah, yours are totally outside forces.
I'm fine.
You're worried about your finances?
Yeah.
I mean, that's the thing. When I find myself getting depressed, it's not because of any chemical imbalance. It's because I'm looking at my life and I'm like, God almighty, I worked so hard for all this and I'm nowhere!
It's outside forces. It's outside. I mean, there's nothing you can do.
And then
about
I have
that.
people blaming me for the choices I made in my life.
Oh,
What? I sacrificed my life. I sacrificed having fun with my friends to get certificates to become what I wanted to be, and then the floor just dropped out for me in 9/11. You know,
you should have just become a professional victim and say that and fake a hate crime and then get like money and then we'd be fine.
Man,
hey.
I really could do that too with my style proclivities. I could easily claim, yeah, come on, I don't do that.
It's
stuff.
so stupid, but that's how people are making money, and then they're trying to say, well, the more money you make, it's because you're a responsible hard worker. No, it's not.
I know I know of so many irresponsible people making bank.
You know how much work
and yeah.
You know how much work it took to like write the book and do the car and all the art and all the cards and all the stuff that I did and working on another one. And that took a lot of time and a lot of work, and it wasn't like I was just sitting around. And yet, and there's certain things enforced to make it even harder for people who want to sell their own stuff and do their own stuff. It makes it harder for them.
Yeah.
And then you have to throw in the case where, everyone's psycho these days, and if you say something that they might not agree with, then you got to be shunned from every community online because of whatever.
Right.
So there's that.
Right.
That's not helping. But yeah.
Yeah. So there we go.
Breathe in.
Go ahead and leave some comments on the topic. Explain your situation, what you've faced with pharmaceuticals.
Yeah.
Oh, one more thing though, I forgot to say this. It's like the side effects you were facing, right? I'll bet you that if you went in and you said, I was having these side effects, they'll be like, oh, well, here's a pill for that.
Yeah.
And then you'll get that pill, and then you'll find that pill has side effects, which you need this pill to counter those side effects, and on and on and on and on.
And then that's how you know that they don't really care about solving the problem.
That would just be, oh, well, here's more money for me, and more money for the pharmaceuticals, more money for the pharmaceuticals. And another thing, this week I was hearing on the radio, there was a pledge drive for helping children in Botswana or someplace like that who had parasites. Okay? Parasites are bad, right? But they were saying that for 44 cents you can cure a child of parasites. Now here's the thing. I'll bet you that medicine that they used for one child to cure them of parasites, I'll bet you that medicine costs $500 per dose in the States.
Yeah, that's how they can afford to. Yeah.
Yeah, this is the other situation that we're facing. Is the United States, we pay so much more for our pharmaceuticals, for our medicine. It's a crime. As I'm sure you all know this. I'm probably just going over territory you already know. So on that note, like I said, leave comments and explain if you faced anything like this, or anybody you know has faced this, and maybe we'll talk about it later. All right, have a good day. Bye-bye.